Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine podcast. I'm your host, Yaron Ivan, as usual. And today, again, more important rules that hopefully will help you take care of your pediatric patients in the Pediatric Emergency Department. Rule number 171. Don't find the reason, rule out the bad ones. So this is a rule that, again, I think goes back to very basic emergency medicine or pediatric emergency medicine. We're not here to win. We just don't want to lose. That's another rule. This is all about the fact that as a pediatric emergency medicine department physician or clinician, your job, my job, is really to rule out anything serious, surgical, life-threatening, etc., and then decide on the appropriate disposition of the patient. And I think it's very important that we have that mantra in our head with every patient we see. I think I have a very good example for this rule of a patient that I recently saw. So this was a 7-year-old who was transferred to our pediatric emergency department from a different emergency department with acute appendicitis. The hospital where the patient came from does not have pediatric surgery, so the patient has to come to our facility, which is obviously very understandable. When I sat with the mom and the patient, turns out that he actually presented to the other pediatric emergency department 2 days ago with abdominal pain. According to the mom, that day, the physician obtained the KUB, saw a lot of stool, diagnosed the child with constipation, sent them home. Unfortunately, the child at home continued to have abdominal pain, started having some vomiting, I guess, and went back to the emergency department. At that point, he was diagnosed with appendicitis, appropriately so, and now sent to my hospital for surgery. And it struck me that perhaps the physician who saw him 2 days ago was very focused about finding the cause of the abdominal pain. So we all know one of the most common cause of abdominal pain in the pediatric emergency department, and for some reason it's more common in boys, is constipation. I think the physician who saw him 2 days ago made a mistake of thinking, let's find the reason, probably constipation. Let's get a KUB and see if there's stool. I always tell my residents, my medical students, and now fellows, unfortunately for us physicians, if we get a KUB on a patient, we will never find gold. It's always going to be stool. So once the doctor saw some stool in the abdomen, he put it together with the abdominal pain, diagnosed constipation, and sent the child home. And I think that approach is very often a double-edged sword. I know there's sort of a tendency or a desire to make a diagnosis, but I think if you approach the patient with that goal, oftentimes those things can happen. So I think it's more important to see a patient with abdominal pain and think about, okay, I need to know, I need to prove that this is not appendicitis, serious, surgical, etc. Whatever surgical abdomen you need to find based on the age, of course, you can go back and look at the rule of 6. But I think it's important to apply Rule 171 and not try to find the reason, but then again, rule out the bad ones. If you see a child with abdominal pain, remember, your role is to rule out surgical abdomen. Your role is to rule out anything serious, surgical, bad that will put the child at risk. You're not here to find a specific diagnosis. Many kids present to the pediatric emergency department with abdominal pain that we cannot diagnose. We have no test for gastroenteritis. We have no test for abdominal migraine. We have great tests, however, to rule out appendicitis. So remember Rule 171. Don't find the reason, rule out the bad ones. Rule number 172. You are allowed to fail. You are not allowed not to try. So again, this is another rule I can best explain with an example. I received a call a few weeks ago from one of the community pediatric emergency department that unfortunately cannot admit kids. The physician wanted to transfer a newborn with fever. The newborn, I think, was only 6 or 7 days old. Clearly in that age, 7-day-old with a fever needs to be admitted to the hospital. When I asked the doctor, what studies or what labs have you obtained? He said that he got the CBC, which looks okay. His nurse was about to obtain the urine, but he did not do an LP. When I asked the physician what was the reason for not doing the LP, he said that since the patient is already transferred to us, he figured we would do the LP. Now, let me be clear, LP on a newborn is one of my favorite procedures to do, and I also like having the opportunity to teach my fellows and the resident that procedure. However, I told the physician that given the patient presented to him, newborn, with a fever, he has to do the LP. When I said that, the physician felt a little uncomfortable, saying he doesn't do LPs on newborns very often, which I completely understand. Nonetheless, I think as a physician who saw the patient first, you have to try, and if you fail, by all means, ask for help, ask for transfer, etc. But it makes no sense to me to be the first physician to see a newborn with a fever that clearly needs a lumbar puncture and not perform it, thinking the patient is going to go to another hospital anyway. So remember, you're allowed to fail, you're not allowed not to try. The same thing goes for those patients who have a straightforward forearm fracture and need a reduction. Reducing a forearm fracture in a toddler or in an older child, and as long as they're not particularly obese, is a fairly easy procedure. Giving ketamine is also very easy and very safe. So when you're the physician who's seeing that 70-year-old with a straightforward forearm fracture that is mildly displaced and need a reduction, you should by all means give ketamine, sedate, and try to reduce the fracture. And if you didn't succeed, you can splint the patient and send them to someone else, but you're allowed to fail. You're not allowed not to try. Do what the patient needs, give it a try, do your best, and by all means, if you don't succeed, ask for help. So remember rule number 172. You are allowed to fail, you're not allowed not to try. Rule number 173. Remember, mental status is a vital sign, maybe even the most important one. This rule, I think, goes back to very basic medicine, or especially pediatric medicine or pediatric emergency medicine, indicating that the way the child behaves is oftentimes the most important aspect of the physical exam, and I would consider that a vital sign. A good example is the patient who, let's say, ingested some medications. Him or her are very sleepy and completely oblivious to you looking in their ear and doing the physical exam. However, their vital signs, respiratory rate and pulse ox may actually be okay or even normal. I'm always a little worried about a patient, especially a toddler, who's completely oblivious to me, looking in their ears, not responding, not crying, etc. I'm also a little nervous about a patient that sees me entering the room, physician, somebody who's a stranger, and does not respond negatively to me. I kind of expect a negative response most of the time. Remember, if the airway is open and the patient is breathing, the pulse ox will be normal. Many drugs don't necessarily affect your respiratory rate or your heart rate, but the child can still be at risk. So I often believe that mental status is probably the most important vital sign out there. The same thing goes for those highly febrile patients, perhaps in a different way. When I walk into a room, chief complaint is fever. The patient is sitting there happy, smiling, interactive with 104.5. I don't think I'm particularly worried that this child has meningitis or pneumonia. If he or she are well appearing with a very good mental status, of course, add to the fact that they're normal, healthy kids who are vaccinated, fever doesn't scare me much. So remember that rule next time you go into the room. There's a patient there whose mental status does not seem appropriate for a child that age. Even if the respiratory rate, heart rate, and pulse ox are normal, you should be a little concerned, do a very good exam, take a very good history, and see if there's anything that will put the patient at risk. So remember, rule number 173. Mental status is a vital sign, maybe even the most important one. And that is it for today, guys. Thank you very much for listening. Let's review what we learned. Rule number 171. Don't find the reason, rule out the bad ones. Remember, your role as an emergency provider is to rule out surgical, serious, or anything life-threatening. You don't necessarily need to find the diagnosis for the abdominal pain. You got to make sure it's not a surgical abdomen. There are many ways to do it. Sometimes history and physical are sufficient. Sometimes you need to go all the way to abdominal CT, unfortunately. Rule number 172. You're allowed to fail. You're not allowed not to try. Always follow the protocol and give the patient what they need. do what you need to do for the patient. And if you don't succeed, there's always help. You can call a different attending, you can transfer the patient to a specialized pediatric facility, etc. But you should always try to do the right thing. You're allowed to fail, you're not allowed not to try. Rule number 173, remember, mental status is a vital sign. I'm always a little weary about a child who's completely oblivious or even obtunded in the examination room, even though the heart rate may be normal. No significant tachycardia, no significant bradycardia, etc. I'm also always a little weary and worried when the child is completely oblivious to my presence. I look in their ear and they're not responding, etc., even though the respiratory rate is normal and the patient is not hypoxic. So remember rule number 173, mental status is a vital sign, maybe even the most important one. And that is it for today, guys. Thank you very much for listening. I appreciate the support of Prem Rules. Please continue to check the website. I've gotten some really great feedback and really great reviews, things that I use for future podcasts and future topics. I love hearing from you guys. You can also check my articles on EP Monthly and the Facebook page. Contact me however you wish. I always love hearing from you guys and getting more and more feedback. The following outro is a great song by Green Day, again from the 90s. This is called When I Come Around. Hope you like it. Have a great day.